is another confirmed coronavirus case in Wichita County, bringing the total now to 4, and all are travel related.
So here's what we know so far. The latest case involves a 49-year-old patient who traveled to New York. The victim flew from DFW into Wichita Falls on Monday on flight 3715, which arrived at around 11:33 p.m. According to the health district, this person took a Skylark taxi to La Quinta Inn, located on East Montgomery Place. The patient was transported on Wednesday to United Regional and is listed as stable. Health district officials say the patient had only limited contact with hotel staff.
If you were a passenger on Monday's flight 3715, the health district wants to hear from you. Just call the hotline right there, 940-761-7909. That number will also be a place to get your questions answered, like where to get tested, should you get tested, or what are the symptoms.
This is an important resource, especially for those who do not have a primary care physician. Again, the number is right there on your screen. You can also find it on Texomashomepage.com, and the hotline hours are from 8 a.m. to 6 p.m.
One of Wichita Falls' coronavirus cases has been identified as an employee for Work Services Corporation.
PJ Green spoke to officials at the nonprofit about how this will impact them and the businesses they serve. PJ?
Well, Daryl and Mel, while the WSC has employees that have worked at various sites, including Shepherd Air Force Base, this employee works at the headquarters on Hatton Road. The employee that tested positive for the coronavirus returned from Seattle on March 7th with no symptoms. After several days at home, the employee returned to work and experienced shortness of breath on March 17th. The employee had minimal exposure to other employees, but 6 employees have been told to self-quarantine by the Wichita Falls Health Department.
After that happened, we've been coordinating very closely with the health department to let them know the procedures that we've had in place, and we were pleased that their response back to us is that there's nothing really more that we could have done at this point.
Another case of COVID-19 in Wichita Falls is further proof that this virus is silent and deadly.
The virus typically is very quiet when it first infects somebody. For 1 or 2 days, they may have no symptoms, but they actually can pass the virus on to others.
The Work Services Corporation is doing what they can to make sure the coronavirus doesn't spread.
One of the things we did is we tried to shut down and stop any non-essential business operations, but the fact of the matter is many of our services on Shepherd are essential business operations.
WSC's employees who work at headquarters are working from home today as the building is health-grade sanitized by a certified vendor. Top WSC officials will decide this weekend on how headquarters will operate as the country and the world continue to battle the coronavirus. But health officials have a word for all businesses during this time.
I would recommend they look at what they provide and see if it's something that's going to help the community in what we're dealing with, or what they're providing is going to actually amplify the spread of the virus.
And when I asked Too Good about workers at other sites, at that site and at Oklahoma, he said none of those employees have showed any signs of infection. And since the WSC employs people that are at a higher risk because they have disabilities, they are asked to take all necessary precautions.
Right. Okay, PJ, thank you so much. Now, here's an update on the numbers of cases here in Wichita County and testing numbers. As of this afternoon, there were 4 confirmed cases of COVID-19. 47 people have been tested, and they have 10 negative results confirmed, with 33 test results pending. If you have any questions regarding this virus, testing, or seeking care, the health district does have the hotline again that we talked about earlier.